Boom! It lights up. What causes chronic low back pain and sciatica? Which exercises you should do, which exercises to avoid, how to rewire an overactive pain alarm system, and how to reduce inflammation and finally get some pain relief by addressing stress, fear, and an overprotective nervous system. If you're new here, I'm Dr. Anthony Davis. I had debilitating chronic pain for over 10 years, so I know what it's like. I want to help you overcome that without drugs or surgery or injections or endless doctor's appointments, using lifestyle change that you are in control of. Oh, and to keep it evidence-based, I'll be citing peer-reviewed research the entire time. So let's talk about what causes pain. We have physical factors, inflammation, and mental and emotional factors that are often overlooked. Now, most people assume that back pain or sciatica has to be caused by something physical, like a disc herniation, nerve compression, sacroiliac joint pain, or some kind of asymmetry, like a hip hike, a short leg, an anterior pelvic tilt, or a muscle imbalance, tight hip flexors, weak glutes, that kind of thing. But did you know, come here. Did you know that research over decades has thoroughly debunked the idea that we could blame chronic pain on just one simple structural finding? If you're worried about a disc herniation, well, guess what? Everybody has disc herniations, whether they have pain or not. So it's not that disc herniations don't matter, but they don't matter as much as you think they do. And even if you're worried about a disc herniation compressing a nerve, it turns out that at least 23% of people are walking around with nerve compression on their MRI, and yet they have zero symptoms. So we can't even blame nerve compression 100% for a person's pain. Oh, and by the way, these models suck. It makes you think that your discs are like a balloon, but actually they are like tough rubber. The spinal discs are very strong. But then if you're trying to avoid surgery, people start chasing postural asymmetries like a short leg, a pelvic tilt, scoliosis, or muscle imbalances. But a quick look at peer-reviewed research shows that an anterior pelvic tilt really can't be blamed for pain because 85% of men and 75% of women will have an anterior pelvic tilt even if they have zero pain. And studies show basically the same thing for any kind of postural asymmetry. Like pretty much everybody has one leg that's a little bit shorter than the other, and it really doesn't matter. And there's really no convincing evidence showing that the curve of your spine makes a big difference, whether that's too much back or forward, or even if that's a little side to side like a scoliosis. I'm not saying those things never matter at all. What I'm saying is it's just one little piece of a very big pie. So let's take a look at the pie. Okay, so we have a lot of different things that contribute to chronic pain. Yeah, we have things like your MRI findings, your disc herniation, disc degeneration, nerve compression, but that's one little piece of the pie, and you really can't do anything about that unless you want to have surgery. And even then, even if you address this whole piece of the pie with surgery, you still have the rest of this that's causing chronic pain, like physical fitness, mental health, neuroplastic changes, which is like hypersensitivity. You have your genetics, right? Which again, can't really do anything about it, but it's just a small piece of the pie. So let's get rid of that. Look, we have all of these other things, sleep, nutrition. In mental health, we'd have stress and fear, anxiety, depression, even people with a history of trauma. These are all factors that we need to address with your mental health. Physical fitness looks like mobility, strength, full body physical function. We've got a lot of stuff to work with without having to worry about your MRI findings or your posture or your asymmetries. As far as physical fitness, mobility, and strength are concerned, it's not about fixing your alignment. It's about making sure that you don't skip steps and do too much too fast, because that's how you get injured. Or baby yourself, do too little for too long, become weak, and then you're more easily injured just doing basic daily things. So we need to find the Goldilocks zone and develop full body mobility and strength. And don't worry, I'm going to give you plenty of exercise examples in just a minute, but first let me give you real human examples. For example, our client Joanna came to us after years of avoiding bending her spine because she was listening to advice from Stu McGill and others who told her that bending her spine was dangerous. This meant she was doing too little for too long. She was babying it. And once we got her to move and express range of motion, bending in any direction, and build confidence with those motions, she was able to get back to running a 5K with her daughter, lifting weights, full body exercise, and feel great doing it. Or the opposite example is like a current client of ours, Marty, who's a handyman, and every day he's working his tail off with physically demanding work, and he doesn't have any rest times. So when we've been able to get him to take more rest days and sharpen his mobility so he's not just doing the same repetitive task over and over, but getting a more well-rounded approach to fitness with appropriate rest and recovery, now he does much better when he's not overdoing it and doing too much too fast for too long. So the moral of the story is don't skip steps and overdo it because you'll get hurt, and don't baby yourself either. Be like Goldilocks and gradually improve over time. But stop worrying about your posture, your asymmetries, and your MRI findings. Those are not a very large part of the pie. Focus on the bigger things. Don't skip steps and don't baby yourself. The next thing that causes chronic pain is sensitization. Whew, that's hot. Basically, you have inflammation. It's not about damage. It's not that something's broken. It's that things are way too sensitive and you have an overactive pain alarm system. Let's take a look. Pain in the brain operates a little bit like touching a fire. When you touch the fire, you'll damage yourself. So the body has an alarm system that's built in where I should be alerted to danger before I actually burn myself or hurt myself. That's normal. So we have pain before we actually have damage. But with chronic pain, what happens is if normal pain is like taking this piece of paper and saying, how close can we get to the fire before we start a fire, right? I'd have to get pretty close and then we get a fire. Well, chronic pain is like if we took this piece of paper and we have inflammation. We literally have neurochemical inflammation in the nervous system, in the spinal cord. Your neuroimmune system is creating inflammation, things like histamine, substance P, CGRP, and other inflammatory chemicals, which is kind of like pouring this lighter fluid all over the body, where now, if you get anywhere even close to a fire, not only do you not even have to get very close to it, oh, this is going to get messy, but if you do get close to it, boom, it lights up. Wow. Like really, really lights up. And this is actually really interesting. The fact that there's still fire after I'm away from the damage, there's still pain when you're no longer being damaged. And that's a lot like how chronic pain works. Big, explosive reaction, dramatic reaction of pain, an overactive alarm system that's trying to keep you safe, but it's actually just making things worse. And you know what's funny is after that reaction, which was a bigger, more dramatic reaction than I expected, now I'm actually a little nervous playing with fire in the same way that you might be nervous around bending your spine, lifting things that are heavy, and doing normal daily tasks because you've had a big explosive reaction in the past and you assume that that must mean you caused damage. But again, in this case, it wasn't damage. It was more inflammation. So how do we fix this hypersensitivity? Well, we make you tougher and more resilient, and we sort of fireproof you by building your strength and your resilience, reducing stress, reducing inflammation, getting better sleep. And now you can expose yourself to difficult things and you don't get set on fire. Okay, now that that's all cleaned up, the last thing that causes chronic pain is mindset and mental health. Let's talk about it. So let's say I wanted to pick up this ball. Well, if I'm healthy and I'm mobile and I'm strong, no problem. But let's say even if I was strong, I'm dealing with high stress, anxiety, fear, depression. Maybe I lost a loved one or I had a big life event happen and I'm dealing with a lot right now. But now before I pick up this ball, I gotta put the weight of the world on my shoulders before I do it. So my packing list just to go out the door is high stress in my life, plus anxiety, plus fear because I'm afraid of my medical condition, and that's gonna raise my stress levels. So I got to put this on before I can even go out the door. Oh, wait, I'm not done yet because I also got a crappy night's sleep. And on top of that, I'm eating like crap because I'm so stressed out. So I'm eating super inflammatory foods. So this is me just going out the door. And now going to pick up this ball, it's not so easy. It's a little awkward, don't you think? But I look fit. I look young. I look healthy. Why am I having pain? Why can't I pick up this ball without hurting myself? It shouldn't be this hard. Well, we got to figure out some way to offload some of this stress, get you better sleep, get you some healthier food, take some of the burden off, get you a pressure release valve, have you reduce your fear by proving to you that you are safe, that you are capable, and get your nervous system to calm down. And your nervous system is not going to calm down as long as you feel like you're carrying the weight of the world on your shoulders at all times. And this is why it feels like a mechanical thing. It hurts when I pick up the ball. It hurts when I bend forward. It hurts when I do activities. But this is you're dealing with too much shit in your life issue. So your body is physically taxed from the mental and emotional burden. And this is why we cannot say that chronic pain is just physical, but we also can't say that it's just mental and emotional. It's the combination of these things and other lifestyle factors. But unfortunately, as a result of this overwhelm that we deal with chronic pain, this results in catastrophization. We fear pain so much that we make things worse. It's like getting your fingers stuck in a finger trap. The more that we resist it, the more we're thinking about pain all day, fearing every aspect of our life. What if I have to bend? What if I have to twist? What if I make a promise to go do an activity that hurts me? So we wall ourselves in, we fight it, we fight it, we fight it. And the more we fight it, the worse it gets. So when we can get ourselves to relax and stop thinking about pain all the time and get ourselves to do things that are meaningful in our lives, then things relax and we can escape this prison of chronic pain. Now, I promised we'd talk about exercise, so let's dive in. So what's the best exercise for back pain and sciatica? Is it Jefferson curls or elephant walks? Well, I don't know. If that person has really bad sciatic nerve pain, stretching that nerve is probably just going to piss it off. Okay, so maybe we should just do dead bugs and bird dogs and things that teach you core stability so you never bend your spine. Well, sure, core stability can be a useful option in the beginning of rehab. But if we start to tell you never to bend your spine, it actually creates more problems down the road. That's because if you train your body to sit up perfectly straight all the time, now your muscles never get a break from this posture, so this posture is going to fatigue you, and you'll be super overprotective so that in real life, when you do have to bend over to put on your shoes or do something normal, your back isn't used to those positions because it never moves, so you have a flare-up. So the problem is it's really hard to give individual recommendations in a video like this, because if I gave you 3 exercise suggestions, one of them might be too easy for you. One might be just right. It challenges you, but not enough to flare you up. And then the third exercise might be too difficult and it flares you up. And then even the exercise that's just right for you right now, in 1 or 2 weeks from now, this is going to be too easy, and you need to progress to harder and harder things in order to get stronger and feel better. So the 3 most important concepts for exercise for chronic pain are, number 1, take a full body approach. Because real life, like squatting, hinging, lunging, anything involves all of my joints, my full body to live normal life. So if you're endlessly trying to chase alignment boogeyman, then you're never going to address full body real life and get back to the activities that you love. Number 2 is graded exposure. We start with easy full body mobility and strength, gradually progress to the next step, and we do not skip steps. This is how you hurt yourself, but if you never progress at all, you baby yourself and you only do corrective core stability exercises and glute bridges forever, and then you never get stronger. So don't skip steps, but don't baby yourself, and take a full body approach to mobility and strength the whole time. And the third concept for exercise is our pain traffic light. This is going to tell you what exercises are safe and what exercises are not safe for you today, and that's going to change tomorrow and the next day and the next day. So you need to understand this is a scale of 1 to 10. Mild, moderate, severe pain. Mild pain, 1 to a 3, is pain that's safe to push through. It's not a big deal. Keep exercising. You're not damaging yourself. It's just inflammation. Let's go ahead and challenge yourself. Yellow light is a 4 to a 6 out of 10. This is where we do not want to add more challenge. This already might be a little too much for some people. We definitely don't want to do more. But this is still probably safe if it's not getting worse and worse, and if you feel okay the next day or after your exercises. And then red light pain is a 7 out of 10 or above. This is severe pain. Don't push through this. This is too much. Or if it's flared up the next day, too much, skip it, do something else, do something easier. So I know there are so many exercises and you want to know exactly which ones to do, but there is no way for me to tell you that. If I gave you 100 exercises right now, some of them would be okay, some of them would be too much, some of them would be useless, and some of them would flare you up. We have to teach you concepts, how to take a full body approach, how to know the difference between safe pain and unsafe pain, and making sure that you're not babying yourself and that you're not skipping steps. If you do those 3 things, you'll know how. You need to know how to choose the exercises, right? Or you need somebody like us to tell you which exercises, and I can't do that if I don't know you and the way you're responding to pain. The only way we know that is when we give somebody exercises, then they come back to us and they tell us how those exercises felt, good, bad, easy, hard, whatever, and then we help them modify their exercises based on their feedback. That is the only way to give people specific exercises. There is no other way. The last thing we'll talk about is how to rewire a hypersensitive pain alarm system. This is where people are saying, hey, is pain in the brain? Is pain coming from the nervous system or our fight or flight or stress, anxiety, depression? Let's talk about it. Well, the most important thing is education, understanding that your pain is not 100% caused by the things on your MRI, which means there are some kinds of pain that are safe to push through. There's a difference between safe pain and unsafe pain. But as long as you believe that your pain is 100% caused by something scary that you saw in your MRI, then you're screwed. You're stuck in fight or flight. Your muscles are going to be overprotective, and you're just going to have more and more pain because of the fear of the structure, which we explored the research earlier. The structure doesn't make a big difference. It kind of matters a little bit, but you can really stop stressing out about these things. The other way we're going to rewire the pain alarm system is with DIMs and SIMs. So DIMs are danger in me. These are things that make you feel like you're in danger, like you're under threat. And then SIMs are safety in me. These are things that make you feel safe and protected and confident. So DIMs could be these models, right? Or looking at your MRI report. It sounds scary. Degenerative disc disease, that's terrifying. Or disc herniations. But we can take the same thing and put it over here on the SIMS side, safety, and we can say, well, what is degenerative disc disease? Oh, it's just normal age-related changes. What is a disc herniation? It's really just a little swelling, a little bump on the spine. It's not as big a deal as you think. So things that can make you feel like you're in danger are reading your MRI report, hearing that you need surgery, being told not to bend your spine, being told that your spinal discs are fragile, going to people who scare you and tell you that you're never going to get better, but also lifestyle and people, places, things, going to a stressful job, being around people who are negative, people who make you feel depressed or anxious or fearful. Like your boss, if you don't like your boss, could be on this side. And then things that make you feel safe, which are going to improve your pain, make you feel better, and be part of your recovery, are people who make you feel safe, people who you love, doing activities that you enjoy, that bring meaning and value into your life, practicing exercise in a way that builds confidence with movement, and proves to you that it is safe for you to do exercise, that it doesn't have to flare it up when you bend your spine, and easing into those things gradually. Learning about pain science, like you're doing right now, is a SIM or a safety in me. These are building signals of safety to calm your nervous system and get you out of fight or flight, get you out of that overprotective, muscle guarding, inflammation, pain alarm system response, and get things to calm down so you can start feeling better, get some relief, and get back to normal life. All right, we covered a lot today, so let's recap. Number 1, what causes pain? Well, we can stop stressing out about our MRI, our posture, our alignment, our short leg, muscle imbalances, core stability, and anything else that sounds scary, because those things are not the cause of your pain. Everybody has asymmetries. Almost everybody has some kind of finding on their MRI report, whether they have pain or not. Those things kind of matter. They're one piece of the pie, but they are not the big picture. So zoom out, focus on the things you can control. That's exercise, nutrition, mental health, and sleep. These are what we call the 4 pillars: exercise, nutrition, mental health, and sleep. These things you can control. These things are going to get you back to the active life you deserve. So what causes pain? Well, it's a combination of doing too much too fast or doing too little for too long with physical activity, and lifestyle factors like stress, anxiety, depression, an overwhelming work environment, poor sleep, poor nutrition, and other lifestyle factors. Next, we talked about hypersensitivity, which is like pouring fuel or inflammation on the fire, and this is what causes pain. It's not about damage. Chronic pain is largely due to inflammation and hypersensitivity. And lastly, we addressed mindset and mental health. We know from research that people who have high stress work environments are 2.8 times more likely to develop chronic pain, and people who suffer from depression are 2.5 times more likely to develop chronic pain. So mental health matters more than most of the things that you would find on your MRI report. We need to address stress, anxiety, depression, and fear. Even if you don't feel like mindset is a big factor for you, and you feel great with your mental health, awesome. But I guarantee that living in chronic pain is causing fear, or at least putting you on edge and making your muscles and body tight and guarded and putting you in a fight or flight state. We need to get you out of that fight or flight state in order to get over chronic pain. So the most difficult part about all this is deciding what you specifically should do. Which exercises should you do? For how long? When should you progress your exercises? When should you modify them? How do we address stress for your life in a way that works for you? How do we combine those things, the stress and the exercise, in a way that makes sense given your life, your goals, your history, and your abilities? So the only way that we can actually answer those questions is to get to know you. We need to know more about you, your situation, what you've been through, in order to put together a plan that works for you. So there's 2 types of people. People who are going to watch this video and they're just going to try to make it up on their own, throw spaghetti at the wall, figure it out, see what sticks. And I've given you enough education and guidelines that if you're really motivated and you don't mind treating yourself like a human guinea pig, then you could make some progress on your own, and I wish you the best of luck. But many of you are looking for support. You want one-on-one guidance. You want somebody to help you navigate the highs and lows of rehab and put together a personalized plan for you. So if you'd like our help, we're offering a free call. You can get on a call with our team. We'll get to know your situation, what you've been through, what you're capable of, what are your goals, and we'll help to put together a personalized plan for you. You'll walk away from this call with a better understanding of why you're in pain, what you're missing from your rehab, why you're stuck, and most importantly, what do you need to do next? Now, the reason we do this call for free is a few reasons. One, I dealt with chronic pain for over a decade. I had a lot of people help me along the way for free, and I feel like it's my responsibility to give back. Also, because some of you want to know about what our program looks like, what it would look like to work with us one-on-one, for us to design you a personalized program. So we want to give those people an opportunity to get to know more about what we do. But first, whether you're interested in working with us or not, we need to get to know you to see if we can help you. And whether or not we do end up working together, our promise is this: you're going to walk away from this call with a breakthrough of understanding, of clarity, and confidence in knowing what you're doing next. So take advantage of this time, book a call with our team. We'll get to know your situation and help you understand where to go from here. It can be very complicated trying to figure out chronic pain rehab on your own. So if you want the help of us, where we've worked with hundreds of people with chronic pain, where I personally dealt with chronic pain. My associate, Dr. Blake, who works with all of our one-on-one clients, he's dealt with chronic pain and overcome it as well. If you want experts to guide you through, if you want clarity, if you want to stop guessing, and if you want to stop wasting money on chiropractic treatment and massage and acupuncture and red light therapy and shockwave and looking down the road of surgery and injections and medications and a lifetime of chronic pain, which I'm not trying to be scary, but the reality is chronic pain, chronic back pain is the #1 cause of disability on the planet Earth. So if you want to bypass all of that, get a plan that works, that's proven, that's evidence-based on decades of research, plus all of our clinical experience, years of clinical experience, and hundreds of success stories, then book a call. We'll talk to you soon. We can't wait to get to know you. We can't wait to see how we can get you active again and get you back to the life that you deserve. So take advantage of this time. Click the link below. If you're watching this on YouTube, then click the link in the YouTube description box, or if you're watching this on a web page, then click the link below, book the call, and we'll talk to you soon.